Provider taxes are a form of legalized money laundering that allows the states and healthcare providers, like hospitals and insurance companies, to profit by placing the burden of state Medicaid spending on federal taxpayers. Here's how these schemes work. For most enrollees, the federal government reimburses an average of 60% of state Medicaid spending. Without provider taxes, a provider, say a hospital, bills the state for $100. The state then pays the provider $100, so it's down $100. The state then asks the federal government for 60% of the fee that they paid to the provider and gets reimbursed. So federal taxpayers have paid $60, the state has paid $40, and the provider has earned $100. Notably, the state and federal government share responsibility for Medicaid costs and outcomes. State Medicaid reimbursements with provider taxes work quite a bit differently. First, the provider will ask to be taxed, which will make sense in a second. So the state taxes them, let's say $100. Then the provider pays the tax. Next, the provider will bill the state for $100 of services, which the state pays. And here's where the money laundering scheme begins. The state will now use extra payments to make the provider whole for the taxes they paid, essentially paying them $100 additional. That makes the entire cost of Medicaid coverage to the state appear to be $200. The state can now bill the federal government for 60% of $200, which in this instance is $120. So federal taxpayers are down $120, the state is up $20, and the provider is up $100. In essence, the state and the provider can collude to each make money at the expense of federal taxpayers. As you can see, this scheme enables the state to avoid responsibility for Medicaid costs and outcomes. As a result, states increase payments, with the tax scam fueling ever higher amounts. The providers make more money, with the states passing the bill to Washington. To reel in Medicaid costs and remove these harmful money laundering schemes, Congress should increase accountability and remove incentives for states to game the system.